If you're leading frontline workers, your nervous system might already know what your organization hasn't acknowledged yet. Your team needs trauma-informed care, not just performance management.
Did you know that trauma impacts how we navigate our careers, but most career advice ignores this reality? Imagine feeling confident and safe at work while honoring your healing journey. Welcome to your Trauma Wise Career Guide, the podcast that reimagines career development for trauma survivors. I'm your host, Cindy Bennett, a trauma survivor turned trauma-informed career coach and founder of the Resilient Career Academy. If you're navigating your career while honoring your healing journey, you are in the right place.
Hey there, I'm Cindy Bennett, and welcome to your Trauma Wise Career Guide. Today we're talking about something that's been really weighing on my heart lately: trauma-informed leadership for frontline workers. And here's why this matters so much right now. We have organizations full of people who are doing incredibly difficult work that exposes them to others' trauma and distress every single day. And while many of these organizations pride themselves on delivering trauma-informed care to their clients, they're not leading their own teams with trauma-informed approaches. The result? Burned out workers, high turnover, compassion fatigue, and leaders who feel caught between impossible demands. So today, we're going to explore what trauma-informed leadership actually looks like when you're leading people who are on the front lines of crisis, distress, and trauma exposure. We're going to talk about nervous system realities, the impossible balance leaders face, and what it means to build regulation and sustainability into the work itself. Because here's the thing, trauma-informed leadership is soft. It's not about lowering standards or removing accountability. It's about understanding how nervous systems actually work under chronic stress and creating conditions where people can do excellent work without destroying themselves in the process. Let's dive in. So first, let's talk about who we're talking about when we say frontline workers. We're talking about healthcare workers like nurses, EMTs, hospital staff, emergency responders like firefighters, paramedics, police officers, therapists, and counselors who are holding space for people's most difficult experiences, social workers and case managers navigating crisis after crisis, teachers and childcare providers managing classrooms while supporting children through trauma, retail and service workers, especially those working during times of crisis or high stress, transit workers, customer service representatives who are the first point of contact when people are in distress. Essentially, we're talking about anyone who is the first point of contact during crisis or distress. Anyone whose job requires them to be exposed to others' trauma, pain, or dysregulation as a regular part of their work. And here's the common thread. All of these roles involve exposure to others' distress and trauma as a job requirement, not occasionally, not as a rare occurrence, but as a fundamental part of what the job is. Now let's talk about what that does to a nervous system. When you're constantly witnessing or holding others' trauma, your nervous system is in a state of activation. When hypervigilance is literally a job requirement, when you need to be scanning for danger, anticipating crisis, reading people's emotional states to keep yourself and others safe, that takes an enormous toll. You're being the container for others' dysregulation. You're absorbing their fear, their anger, their pain, their panic. And your body doesn't really distinguish between experiencing trauma directly and witnessing it happen to someone else. Your nervous system responds either way. This leads to what we call vicarious trauma and compassion fatigue. And I want to be really clear about this. These aren't signs of weakness. They're not evidence that someone isn't cut out for this work. They're the normal, expected response of doing work that requires constant exposure to others' suffering. Your nervous system is doing exactly what it was designed to do. It's responding to threat and distress. The problem is that it's doing this day after day after day, often without adequate time or support for regulation and recovery. Now, here's where I want to humanize the leadership piece, because this is important. Leaders of frontline workers are facing an impossible balance. On one side, you have organizational demands, metrics that need to be hit, documentation that needs to be completed, compliance requirements, budget constraints, performance evaluations. These things are real. They matter. They can't just be ignored. On the other side, you have human needs. Your team members need emotional support. They need recovery time. They need compassion. They need someone to acknowledge that this work is hard. And here's the heartbreaking irony. Many organizations that deliver trauma-informed care to their clients don't lead with trauma-informed approaches internally. The social workers providing trauma therapy to families are being managed without trauma-informed leadership. The nurses caring for critically ill patients aren't being cared for themselves. The teachers creating trauma-sensitive classrooms are working in schools that don't apply those same principles to staff. Most leaders weren't trained in trauma-informed leadership. They're doing their absolute best, but they're trying to support their teams while managing their own activation, their own stress, their own nervous system responses to the work. And the paperwork and the emotional care feel like competing priorities, when really they should be integrated. That's what we're here to change. So let's talk about what trauma-informed leadership actually looks like for frontline workers. I'm going to walk you through 5 core principles. Principle number 1, recognizing nervous system regulation as an occupational reality. The first principle is this: nervous system dysregulation isn't personal failure. It's an occupational reality. When someone on your team is struggling, when they're reactive, when they're withdrawn, when they're making mistakes they wouldn't normally make, that's not evidence that they're not good at their job. It's evidence that their nervous system is doing exactly what nervous systems do when they're exposed to chronic stress and trauma. As a trauma-informed leader, you're developing the capacity to recognize signs of dysregulation in yourself and in your team. You're creating space to acknowledge the impact of the work without making people feel like they're failing. This might sound like, that was a really difficult situation. Let's take a few minutes before we move on to the next thing. Or, I noticed you've had 3 crisis calls in a row this morning. What do you need right now? You're normalizing the reality that this work affects us. Principle 2, building regulation into work structure. The second principle is about structure, and this is where it gets practical. Adequate staffing isn't a luxury, it's nervous system care. When people are chronically understaffed, they're in constant activation because they literally cannot meet the demands being placed on them. Their nervous system is in survival mode all the time. Trauma-informed leadership means fighting for adequate staffing. It means protecting decompression time between intense situations, not scheduling back-to-back crisis interventions or difficult client meetings with no break in between. It means giving people permission to step away when they're dysregulated, not as a failure, but as a necessary part of doing this work sustainably. And it means having recovery protocols after particularly difficult situations. If someone just dealt with a traumatic patient outcome, or a violent incident, or an incredibly difficult client interaction, they need time to regulate before they're expected to perform at their usual level again. Principle 3, creating emotional safety. The third principle is emotional safety, And this means leadership that models appropriate vulnerability. When leaders can say, "That was really hard for me too," or "I'm struggling with this decision," it gives everyone else permission to be human. It means creating permission for people to say, "That was hard," without being seen as weak or unprofessional. In many frontline environments, there's still this expectation that you should be able to handle anything without it affecting you. That's not realistic and it's not healthy. Trauma-informed leadership means peer support that's facilitated, not just hoped for. You're actively creating opportunities for people to support each other, to debrief together, to share the load. And it means having debriefing protocols that honor emotional impact, not just reviewing what happened procedurally. Principle 4, practical on-shift support. The fourth principle is about practical, in-the-moment support. This means having physical spaces for regulation, not just break rooms where people are expected to keep working or eating, but actual quiet spaces where someone can go to ground and reset their nervous system. It means teaching and supporting quick regulation techniques that people can use in the moment. Maybe that's breath work, maybe it's a grounding exercise, maybe it's a physical reset. Whatever it is, people need tools they can access during their shift. It means understanding when someone needs to trade off difficult situations. If someone's activated and dysregulated, maybe they need to hand off to a colleague for a bit. That's not weakness. That's strategic team management. And it means normalizing the need to ground and reset, making it completely okay to say, "I need 5 minutes," without explanation or justification required. Principle 5, long-term career sustainability. The fifth principle is about the long game. Trauma-informed leadership recognizes that some people need to move away from direct frontline work, and that's not failure. That's someone who's given a lot to this work, recognizing their own limits and needs. So you're creating pathways that honor their trauma-informed skills. Maybe they move into training or program development or leadership or consultation. Their experience on the front lines is valuable. How can they use it in ways that don't require constant activation? You're offering career development that doesn't require staying in a state of constant activation. You're helping people see their options and supporting their growth in whatever direction that serves them. And you're ensuring access to mental health support that actually understands their specific challenges. Not generic employee assistance programs that offer 6 sessions of therapy that isn't trauma-informed, but real specialized support for people doing this work. Okay, so we've talked about the 5 principles. Now let's talk about what leaders actually need to develop to put these principles in place. First, you need personal nervous system awareness and regulation. You can't support your team's nervous systems if you don't understand your own. You need to know what activation feels like in your body, what your triggers are, what helps you regulate. Second, you need the ability to recognize trauma responses in team members, not to diagnose them, but to notice when someone's in fight, flight, freeze, or fawn, to see the patterns and understand what you're looking at. Third, you need communication approaches that honor activation states. The way you talk to someone who's in a regulated, grounded state is different from how you talk to someone who's activated. Trauma-informed leaders learn to recognize the room and adjust accordingly. Fourth, you need decision-making frameworks that count for collective nervous system state. Sometimes the team needs to push through and get something done. Sometimes the team is so dysregulated that pushing harder will only make things worse. Trauma-informed leaders can tell the difference. And fifth, you need to be thinking about structural changes that support rather than deplete. What policies, procedures, or practices are making things harder? What could you change, even in small ways, to build more sustainability into the system? Now, let me be really clear about what trauma-informed leadership is not. This is not therapy or clinical intervention. You're not your team's therapist, you're their leader. This is not lowering standards or expectations. Trauma-informed leadership is about supporting people to do excellent work, not accepting poor performance. This is not removing accountability. People are still responsible for their work and their professional behavior. This is not treating employees as fragile. It's treating them as human beings with nervous systems that respond to stress in predictable ways. And this is not replacing clinical support. People who need therapy should get therapy. That's not your job as a leader. So what is trauma-informed leadership? It's understanding how nervous systems work under chronic stress. It's creating conditions where regulation is possible, not just expected. It's honoring the reality of trauma exposure as part of the work. It's building sustainability into the work itself, not just hoping people will be resilient enough to handle unsustainable conditions. And it's leading with both competence and compassion. You can hold high standards and care about people's well-being. These aren't opposing values. So where do we go from here? If you're a leader of frontline workers, start with your own nervous system awareness. Begin noticing what happens in your body during crisis situations, during difficult conversations, during high-stress periods. Notice your team's collective nervous system state. Are they generally regulated or generally activated? What patterns do you see? And then begin small with one regulation supporting change. Maybe it's protecting 5 minutes between difficult client sessions. Maybe it's creating a quiet space for regulation. Maybe it's starting team meetings with a grounding practice. You don't have to overhaul everything at once. Small changes create momentum. If you're a frontline worker, I want you to hear this. Your responses to this work are normal. The activation, the exhaustion, the vicarious trauma, these aren't signs that you're not cut out for this work. They're signs that you're human. Needing support doesn't mean you're not strong enough. It means you're doing work that requires support. And here's something powerful. Advocating for trauma-informed leadership is leadership. When you speak up about what you and your colleagues need, you're not complaining. You're offering valuable insight that would help make this work more sustainable. Your trauma-informed insights, your ability to read nervous systems, to manage crisis, to hold space for difficult emotions, these are career assets. They're skills that can serve you wherever your career takes you. All right, let's bring this home. Trauma-informed leadership for frontline workers isn't optional. It's not a nice to have. It's essential for sustainability, for quality of work, for retention, and frankly, for basic human dignity. This is about honoring the nervous system reality of the work. It's about creating approaches that support people rather than depleting them. And it's about recognizing that when we care for people's nervous systems, we're actually caring for their performance. These things aren't separate. The frontline workers in our communities, the people responding to our emergencies, caring for our loved ones, teaching our children, holding space for our healing, they deserve leadership that understands and honors the toll this work takes. And leaders deserve support in learning how to do this well. This isn't about blame. It's about building something better together. So here's my call to action. If you're a leader of frontline workers or a frontline worker yourself, I'd love to hear what trauma-informed leadership looks like in your context. What's one thing that would make a real difference? Share your thoughts in the comments and let's build these approaches together. Thank you so much for being here. Thank you for doing this difficult, essential work. And thank you for being willing to imagine what it could look like if we all led and worked with more attention to our nervous systems. I'll see you next time. You're not walking this path alone. Every step you take toward a trauma-wise career is an act of courage, and I'm here cheering you on. If today's episode resonated with you, share it with another survivor who needs to hear this message. Together, we're rewriting the rules of career success. Keep rising, keep healing, keep building.